back to peptides.
Yep.
There are a lot of gray market peptides talked about on the internet. We can't prescribe them, so we're not going to talk about them here, but let's talk about the ones we can prescribe. And then I would love to hear your thoughts on what you think's coming, next month with RFK and the FDA. I think though they've got that list that's up for evaluation.
Right, it's in limbo right now.
Yeah, tell me about your thoughts on all this.
I honestly don't know. I really want them to put it back on a category 1, because it does help people. Again, peptides are not it's not a universal treatment of anything, but they can be helpful. If when you change your lifestyle and add a few peptides, it can be absolutely helpful. So we'll see. What do you think about that?
I think it was all part of a grand plan. I think this is my thoughts. Mm-hmm. I think that, and I'm making all this up, I have absolutely no proof of any of this, but I think it's all part of a bigger plan. I think it started with Big Pharma agreeing with the current administration to lower drug prices on the GLP-1s to make them more affordable for Americans. What we noticed directly after that, I'm just going on the timeline here, so this is just me putting together the timeline. Directly after that, we saw the FDA really start to come down on the compounded GLP-1s and actually seriously take a look at that. And we saw the FDA come down on the research labs concurrently. And that all happened last fall. About the same time, Trump RX came out and we had those lowered GLP-1 prices, brand name GLP-1 prices. And we saw many of the telemedicine companies convert over to promoting and selling brand name GLP-1s instead of the compounded. So we're seeing that shift happen, which that's cool. I actually see better results with Zepbound than I do with compounded tirzepatide, to be honest with you. So that's all cool. We got the GLP-1s in a vial. I think you can do more personalized dosing strategies that way. I'm a fan, whatever. But I think that what's happening right now, if they do bring them back and we can prescribe them through compounding pharmacies and they come back to category 1, some of these other peptides, I think that might be the play to really come down hard on the research labs, which I'm not opposed to, but I am truly a libertarian at my core, and I don't like it when the government gets too involved with things. Yeah. So restricting people's access to medications that might be keeping them alive or helping them tremendously. Right. Many of these peptides I've seen do the same. Huge godsend for many people. It's just gotten all mucky and murky. And I think your average person in the middle is the one who's getting the shit end of the stick, basically. And so I don't know. I think we're going to see a big push back. I think we're going to see some of these clear, I'm hoping, in July and then September. And I think with that, we'll see a crackdown on the research labs. Mm-hmm. That's my guess. That's just my prediction.
Yeah, let's see.
Yeah. I don't know. But I've been kind of watching it play out, and it almost looks like a game of ping pong. And it's almost like this play is there in order for this play. I feel like I'm writing a script behind the scenes, but we'll see. We'll see how it all goes. I would like to see some of them come back. I think BPC 157 and TB 500. Well, we can talk about that. So what can we prescribe?
Well, pentadecaarginate, that's what right now compounding pharmacies are making. This peptide has been around for, 15 years?
This is the BPC 157.
Yes, athletes have injected it for thousands. I believe millions of people have injected it to this day. Honestly, I have injected it. I have tried on myself every peptide available. PT141 almost passed out.
Really?
Have you tried that?
No. I haven't tried that one.
Vyleesi, it is approved for women hyposexual. Does it work? If you get the dose right, it works.
I think that's how all of them are, though.
It's so hard to get the dose right of PT141. Yeah. It's either going to make you so hot, like you're going through menopause right now in a very, very fast. You get these hot flashes and the whole life is in front of your eyes and I'm about to pass out. What sex? What are you talking about? And then you can underdose and you're like, oh, there's nothing. You're just itching. And
that doesn't sound any fun. That's why I haven't heard great reviews from it. So.
Right.
I did overdose myself on Mot C. I've overdosed myself on Tessamorelin I think,
How did you feel over those?
well, with the Mott C, it was pretty classic. I felt awesome for the first few days, and then I hit a wall, and I did not want to get off the couch. Like, I was just wiped out. I think I revved the mitochondria too hard without the cofactors.
That's explainable because MAT-C, it activates AMPK, it reroutes the energy. So if you were to wait a little bit, but again, MAT-C should not be used by 25-year-olds,
right?
Because you have MAT-C inside of you.
Yes, and you can make it with exercise.
Yes, and 25-year-olds have all the peptides available inside their bodies. So giving them more, I see no benefits. But those gym bros, they know better, of course. I tried MAT-C myself when it was available on Category 1 a few years ago. I felt absolutely nothing. And I've tried it for the whole month.
Interesting.
Nothing. I felt nothing. I've tried, what else did I feel nothing on? Epitalon, MAT-C.
I felt nothing on Epitalon too.
So I tried Disip, only worked on me for 2 nights. Epitalon, I think, would work for someone who just changed who flew from, let's say, Russia to United States. So to rebuild the circadian rhythm, so that's what Epitalon for. Honestly, I don't see any other applications, anti-aging, telomere lengthening. I'm not sure about that.
So I did try SS31. That's something we can prescribe.
Yes, I am trying it right now as we speak.
I was in such an incredible, it was this time last year when I was purging and packing my life and moving. So I was under so much stress. I don't know if it just helped me maintain, maybe, but I definitely didn't get any kind of oomph from it. I didn't feel better, but looking back, I think it helped me get through over that hump. It was a rough time, so.
I do use Thymosin alpha a few times a year.
Yes,
because
me too.
of my T cell deficiency. I think it does help me not to get too much flu when the flu season comes. So I don't get sick as often. Every flu season I would get sick every 3 to 4 weeks. It's unbelievable. With Thymosin alpha. And Thymosin alpha has been approved all over the Europe. People, it's not approved. Thymosin alpha, if it's not approved in United States and it's been approved in other countries, it's a working medication. Come
right.
on,
That's something that I just want to emphasize. We are so like this, and if the FDA has not approved it, but then the whole world might be. In Russia and in Cuba and in countries that were communist, really amazing medicine was happening behind the scenes because they didn't have access to everything. So things like ozone and different peptides were used in plentitude. And when I went to Germany, homeopathy isn't fringe there. It's standard of care.
C-Max and C-Link in Russia, over-the-counter medication.
Yeah.
You can just buy the nasal sprays.
Yeah.
Lots of medication are over-the-counter in Russia, but now with the gray market, it's a chaos.
It is a little chaotic. Just to back up on thymosin 1 alpha, there's a difference between that and TB500, and I've heard you talk about that. Right. So will you clarify for people?
Well, TB500 is the fragment from TB4. TB4 is 43 amino acid long peptide, very long peptide that is being researched in oncology because it implicates in glioblastoma. TB500 is a very short, I think it's the fragment of 15 amino acids. And they isolated that fragment because they believe that that's what actually heals the ligaments and tendons. And it's on the WADA list. BPC 157 is on the WADA list. If it's on the WADA list, then it means it does work.
Something.
Right?
Yes.
It does something.
Explain what that list is for the listeners.
For athletes.
Yes.
For athletes as a doping agent.
Yes.
And most of the peptides aren't on that list.
Mm-hmm. I'll tell you just anecdotally, I have used both TB500 and BPC 157 in patients, even orally. I've seen great results. I prefer, if I'm trying to treat the gut, I prefer BPC 157 orally. I've had much better results with it that way when I'm trying to treat the gut. When I'm trying to treat musculoskeletal conditions, I like it injectable. I have used both at length on my dogs with great results.
I'm going to tell you the story. My cat, 3 months ago, I think it was run over the car. I have a very pretty Abyssinian cat. So the back and the hip was broken. He was paralyzed, waist down. He couldn't walk. I started injecting him with BPC 157 with TB500. He's walking now. He's limping. His doctor said he's probably not going to walk again. When they saw the imaging, they said I would need to buy him a little wheelchair with the back legs. And I said, listen, I will just take him to Mexico and do the surgery that cost here, they quoted me $18,000 for the CT and the surgery for the back and for the hip. Mexico quoted me $2,000.
Wow.
And I could just, fly there with my cat. But BPC and TB in 3 months, I still inject him a few times a week, just twice a week. And he's walking, he's jumping, he's running. He's a happy kitty.
Yeah. Animals, when I see animals respond, I've seen animals respond to homeopathy, I've seen them respond to herbal medicine, and I've seen them respond to peptides and supplements. There's no placebo there. No. There's no preconceived notion. It's a controlled environment because I control their exercise, I control their diet, I can control all the variables. And I cannot tell, so just for the listeners who don't understand, when you spay and neuter your puppies, you're putting them into surgical, like when you spay your female dogs, puppies, you are putting them into surgical menopause. Yeah. And so there's been this huge uptick in ACL tears and ligamentous issues in female dogs. And everyone's like, gee, I wonder why. Why is this epidemic happening? It's because we are ripping their estrogen out of them when they're 6 months old. And so my female dog has been plagued with, she was a rescue. She's been plagued with knee and elbow issues, and just her poor little legs it's constant. And so every time she gets mucked up on the farm, I just give her a little cycle of the TB 500 and the BPC 157, and it's night and day. So, and I feed her well. I feed her really well. She gets lots of sun, but it's just amazing. And so I don't know, I heard you say something on a podcast, you were talking about NAD, and let's talk about NAD, because NAD supposedly injectable doesn't do shit, is right, what the science is saying.
What I've seen have done a lot of shit.
Yeah, right.
Well, again, I live in Miami. Lots of partying going on in Miami. People use substances they're not supposed to use, and then they feel like crap because. And then when you put them on an IV of 500 milligrams of NAD, it usually takes up to 3 hours for those individuals. But then they report in 2 days they can run. They can go back to their lives. But if not NAD, for the week they would be in bed. Yeah. Because all the neurotransmitter, you lost everything. You lost all your serotonin, you lost the dopamine. Your joints are inflamed. Your body is inflamed.
Right.
Also, I have a patient with psoriatic arthritis whom I gave 500 milligrams of NAD, I think 750 once, for 3 weeks. And his flare-up stopped. And he was like, how? I don't know. I read the mechanism, and I see no correlations, unfortunately. Maybe we need to study it more. Maybe we need to study it in people with autoimmune diseases.
Do you think if they did it sub-Q, you'd have the same impact?
I think you need to do IVs first to load the system,
right?
And
saturate the tissues.
And then that's how I did it for myself. I did 10 IVs, 10 sessions, 10 weeks with large doses, and to this day I do microdose NAD 4 to 5 times a week.
Okay. So what do you think of the folks so I always get like the most stingy little, when I do sub-Q, I get the most stingy little bumps and I get all flushed and I feel awful. So I've been terrified to get IVs because even just sub-Q at low doses, I do not react very well.
Yeah.
It's been unpleasant. I've been on this thiamine kick lately. Have you done any, this is just totally random off topic, but I have been obsessed recently with the concept of most of us are running around with frank thiamine deficiencies, especially people. Yeah. Mm-hmm. I feel like God gave me this hit to look into thiamine right before this happened to my mom. And I pulled up some papers from Dr. Pierre Corey, who was using it along with, I believe, prednisone intravenously in ICU patients for COVID. So
I wonder what's the mechanism then.
But yeah, I don't know.
B1 is the brain, neurons.
It's neurologic.
And COVID affects your brain. Absolutely. We had so many cases with neurological deficiencies during the COVID. So thiamine, maybe that plays a role there. Absolutely.
Yeah. And just the complete crash out. So then I started looking into it in elderly folks who were basically the infirm, if you will, and fascinating. Anyway, look into it.
Yep,
You'll geek out on it.
Yeah.
It's been my rabbit hole lately.
All right.
Okay, so let's segue into hormones because it fits into all of this. When we're talking about this popularity and upsurge in hormones and everybody's getting in on it, and all the doctors are getting in on it. And I really feel like a lot of middle-aged women are being preyed upon, unfortunately. And What do you think about pellets? Because I know pellets are, I'm seeing the emails come through like crazy of these companies trying to get me into their pellet trainings. And I'm like, no, I don't like pellets, but I found out you don't either. So talk about that.
Yes, I'm not a fan. You can control the dose. And that's why I'm not a fan. You can just flood the system with so much of estrogen or testosterone. I mean, what good can it do? I wonder, where are the studies? Plus, it's not FDA approved. Where are the studies? I didn't see much. I didn't see much information. And I do have women who got off pellets because they felt like crap on them.
Yes.
I have many actually women who came to me from other practitioners who would put them on pellets, and then their testosterone would be in 500. I mean, it's not a female range; it's a male range.
Yes.
Testosterone of 500, and then it aromatizes, and then your estrogen goes into 500. And you create that inflammation because you flood it with super physiological doses of hormones that your body are not used to.
Right.
Your body goes into shock. Of course, it's pro-inflammatory. It's pro-inflammatory, not.
I had a girlfriend who's a physician, and she put a testosterone pellet in, and she ended up with a grapefruit-sized ovarian cyst that went from palpable to massive. And then I actually, that period of time I was talking to you about off air, that 2-year period where I was in such terrible chronic pain, that started with a pellet insertion.
Oh.
It sent my autoimmune disease into overdrive, and it was a complete nightmare. And then I ended up in that aromatizing, you just cycle of hell, and you get fatter and you're in pain. And so you slow down. So then you aromatize harder. You know, it was such a mess. And it really derailed me for years. Just one little pellet, one little 200 milligram pellet.
I don't think it's a good idea long-term for anyone.
Yeah, I'm not a fan of pellets. Plus, it requires a big cannula. And I gave my husband pellets. He tolerated them really well, actually. But he has the most beautiful tattoo on his back. And I would have to go adjacent to the tattoo or through the tattoo to place them. And it left these little scars, right?
So
like, because the trocar is huge. It's this giant metal thing you're having jabbed into you that they don't show it to you. But the first time I saw it done, I was like, oh, this is shocking. And now he's got these little scars that he can't see, but I can see. And I'm like, I scarred my baby. I scarred his beautiful skin, and all for what? We could have just been doing testosterone cypionate injections or whatever. So, okay. So we don't love the pellets. I don't love the pellets either. I think that they are a little bit of a money-making.
Yeah, that's why they are so popular. But again, I don't love pellets, and I don't love super physiological doses of anything. Even if you inject testosterone. I mean, I have a lot of men who come in and they want 200 milligrams of testosterone or 250 because that's what they heard on Instagram. And then they will get it from underground, and then they are put on DHT blockers, and then they would put on anastrozole, which blocks your estrogen. And by the way, anastrozole is a chemotherapy drug that your kidney hate, but who cares, because you're on the cycle.
Yes. So explain what all those are for the audience so they understand the logic here, because you did a post about this. Like, if you have to take medication to treat the side effects of your
optimization.
Yes.
That's not optimization. So let's say your body needs 80 milligrams. Well, men's body needs 80 milligrams of testosterone, and he decides to inject 200 milligrams of testosterone a week. So what's going to happen to another 120 milligrams of testosterone? It's going to convert to DHT. It's going to aromatize to estrogen. And then you need now finasteride to bring the DHT down, because DHT high equals BPH. That's the bad for your prostate.
And your hair falls out.
And you're going to lose your hair. And anastrozole, because you don't want to have man boobs, but your estrogen goes up. So I see absolutely, there is no logic here.
Yes.
There is no logic where if you want to optimize your hormones, you don't go super physiological. That's a cycle. That's someone who wants to go on a stage and perform for a short amount of time. But someone who wants to optimize their hormones, they have to find their physiological dose, and they have to stick to that. And that's the right thing to do. And that's, again, this investment for the future. You're not fuck up your, DHT. You're not going to fuck up your prostate. You're not going to fuck up the follicles, and lose your hair within 5 years, and go to Turkey and do the transplant.
Go to Turkey. Oh gosh, the turkey transplants. Well, it's such a vast difference. And when I first started talking about microdosing GLP-1s, that was the same concept as like physiologic dosing versus pharmacologic dosing, and there's a big difference. And so the guys that are doing these crazy high doses now, if they're using it, if they have a lot of muscle mass, I'm still not saying it's entirely safe, but if they have a lot of muscle mass and they're using it appropriately and they're hitting the gym like it's their job and they're eating for size and structure, that's a different use of that hormone landing and being utilized. I'm not saying it's entirely safe for their cardiovascular system by any means, but it's an entirely different thing when you are a middle-aged man who maybe goes to the gym and plays around on the cable machine with your, to do your biceps and your triceps, and you call that a gym session, and you're hammering these doses. Vastly different landing and utilization in the body, right?
Absolutely. It's so much. But again, those are gym pros who are 25 to 35-year-old with muscle, with, body fat of 15%, and the rest is a muscle mass. And yes, and then those middle-aged men look at the Instagram like, I'm going to be like them.
Yeah.
I'm going to buy Red online and I'm going to go to the gym and do a few Stairmaster and whatever else.
In their Under Armour shirt.
Yes, and then and then they drink at
they drink at night.
And then I tell them, you can't drink on GLPs, pancreatitis.
Those young guys, I took care of those guys when they were my age. So my practice was inherited. I had built my practice, and then I took over my mentor's practice when he got cancer, and he died, and I ended up taking his practice over. And he had a whole cohort of male patients who had been professional or semi-professional athletes in their youth, and they had been just cranked full of hormones and testosterone and all the anabolics when they were younger. And now I was taking care of them when they were in their 50s and 60s. And I'll tell you, their systems were screwed up. I mean, it was rough trying to just make them feel okay, just trying to keep them out of pain, just trying to keep them steady, trying to keep everything working so that they could have intimacy with their wives. It was just crazy to me how much they had completely screwed themselves up in their youth. Yeah. And it wasn't their fault. In many cases, the coaches were actually the ones administering everything. But it was really eye-opening to me for me to realize, like, oh, there's a cost to all of this. And you burn everything up when you're 25, 35, and you're going to pay for it in your 50s and 60s. I had one patient who had been on so many anabolics. He actually he was a power lifter. He ended up with a massive cyst in his liver that ruptured while he was on the podium lifting, like a massive deadlift.
I had the same patient.
And he just about bled out and died right there in the middle of the competition. And I'm like, what?
I have the same story. But he was saved. He was in ICU. Then he was in the hospital for about 2 weeks with a very nice medical bill.
Yeah, that's crazy.
Yeah. But now he's well and he learned his lesson. And now he does exercise and he does everything correctly. And he looks great.
Yeah.
I mean, you don't have to go through to so much crap to put in your body. For what?
Well, and it brings it back to your average middle-aged guy who's trying to optimize his testosterone, who's taking too much, because that's just like a little baby version of what we just described over here. These guys were going hardcore, but that's not to say that the average dosing isn't too high and too intense. And then you go to these testosterone clinics that are just for men, and they're adding on all those other medications.
Or nobody adds anything on because they don't check.
Yeah, that's
and
true.
Then they get all this. Many of these middle-aged men become so fatigued because their estrogen is high as F.
Yes, and their cardiovascular system is...
What's happening? And their cholesterol is over the roof, their triglycerides, their LDL, I mean, you name it. The liver enzymes are up, everything.
Yeah.
What are you trying to do? You're trying to be like 25? You can't. You can never. You could never.
Well, they don't even check these guys' cardiovascular system.
Exactly.
These guys will go in with a strong family history of cardiovascular disease, like father dropped dead, mom has 3 stents, and never once is cardiovascular protection even discussed. And not to say that testosterone causes cardiovascular disease, but done wrong, it certainly can aggravate, especially if they start aromatizing. It's crazy. So
too much of anything can kill you.
Yes. Well, and too much estrogen is not great either. So.
Yeah. And I mean, I do like testosterone for men. I think it's a great modality, but if done right.
Yes. Same. I think it's kind of a necessary situation in most modern middle-aged folks. I mean, I'm all for optimizing the hormones at around I'm all for looking around 40, 45. Start looking and start treating what you see physiologically, not necessarily. And even young men. I've had several young men in practice who were hockey players or ex-hockey or football players with just absolutely no testosterone because too many head injuries in their youth.
Yes.
And like we had to supplement.
Brain-induced endocrine dysfunction. Absolutely.
Yeah. And it caused some infertility. And they knew going in that was a risk, but we had to do what we had to do because they had nothing. And then they would have chronic migraines and they would have, high estrogen.
Yes. The domino effect.
Yeah. Anyway, all that to say, work with someone who knows what they're doing, people.
Exactly.
Yeah.
And how about that? Women also afraid of hormone replacement therapy.
Yes.
Middle-aged women are afraid of hormone replacement therapy. I don't know, go figure.
It's crazy.